So my name is Owen Bowden-Jones. I'm a consultant addiction psychiatrist working at the Club Drug Clinic in central London. So there have been a number of sort of concerns about ketamine more recently, about its increase in use, about its increase in harm, and increase in people presenting to treatment. And that also led to a sort of interest from the media. People who use ketamine non-medically do so for a number of the sort of desired effects. These include visual and auditory hallucinations, distortions in time and space, and at higher doses, an intense out-of-body experience, sometimes called the K-hole. I think it's important to remember, though, that people also sometimes use ketamine to treat their mental health problems, particularly problems such as anxiety, depression, and the symptoms of post-traumatic stress disorder. Persistent use, particularly at high doses, can lead to a number of different harms, though. These include psychological dependence, cognitive impairment, hepatotoxicity, or ketamine-related urinary tract damage, or sometimes known as ketamine bladder. There are a number of elements to an appropriate treatment response to people using ketamine. The first is cultural competence. So our services, which are typically used to helping people with heroin or crack cocaine problems, need to understand that people who use ketamine use so in different contexts and have a different profile. The second is about specific screening. So whereas many of the assessments and elements of assessment that we use for different drugs work for ketamine, we also need to consider additional types of assessment. So one is an assessment of urinary tract symptoms, which is essential to do in anyone who's using ketamine. And the other is to assess underlying mental health problems, which are often a driver of ketamine use. And then finally, services need to develop a link to their local urology service so they can fast track people who have identified ketamine-related urinary damage through to treatment as soon as possible. Ketamine is listed as a WHO essential medicine, and it's well established in its use for pediatric, emergency and pre-hospital medicine. But more recently, there's been a really exciting development about its use for treatment-resistant and major depressive disorder. And there are a range of other indications currently being explored, including substance use disorders and post-traumatic stress disorders. So there are currently many trials underway looking at this, but we need to wait for the results to understand where ketamine best fits as a new and emerging treatment. So there is genuine excitement about the potential therapeutic benefits of ketamine for a range of emerging disorders. We do need to, however, to wait for the evidence of effectiveness to build. We also need to understand which groups this new treatment might work for, but also which groups might be vulnerable to the harms of treatment. So whilst the evidence is building, we need to continue with appropriate caution. So what we need is a sophisticated approach which facilitates innovative research and drug development within regulatory frameworks which keep patients safe.